No financial disclosures. When we talk about techniques for the Decimase bed preparation, I'm going to go step by step here. The first and very important is to determine the size of the graft to be used. And so we measure with calipers, mark the cornea, then of course we make the incisions. We want to score Decimase membrane, strip it with either viscoelastic, an AC maintainer, or air, and then of course check for complete removal. When we are doing graft sizing to determine the size of the graft, you want to have a look and see if things that are there like PAS, if there's PAS there, you want to obviously avoid that because you won't be able to open your graft and get it to stick. If there is a previous PK, I recommend sizing 1 millimeter smaller than the original graft. And so, for example, if the PK is 8 millimeters, consider a 7 millimeter DSEK graft. Here we can see with the OCT, that's an OCT of a DSEK following a PK, and the lower picture is a one-day post-op, and you can see the DSEK graft there nicely positioned against the PK. Again, you want to measure the area to be scored with the calipers first and then mark. You can mark either with an optical zone marker or with calipers. The advantage of doing marks with calipers, and I'll be showing this in a video in just a moment, is that you can actually see between the marks. There's different techniques, again, for scoring and stripping Decimase. You want to have a full anterior chamber, and whether you do that with a cohesive viscoelastic, air, an irrigating instrument, an AC maintainer is really up to you. Any of these work actually quite well. Scoring Decimase membrane, you can use a reverse Sinski, and a lot of people have this and works very nicely. I really like, I have a MST Decimase stripping forceps. It's a Desmetorexis forceps. It's by MST in India. Focus Ophthalmics and Delhi Eye Zone are distributors. And you can see here, there's just a very, very nice toothed grasper, and that can be very, very helpful, especially for complex cases where you may have a Decimase membrane that's very fibrotic, or if in DMEK, you can also use these. And if you have to pull a graft, sometimes you'll have some little wrinkles, and you can actually help to get those out. I find them extremely helpful. The downside is, of course, that there's a cost there, but it is reusable. With scoring Decimase membrane, you want to be sure not to press too deeply. Don't strip the stroma. If the stromal fibers appear, then stop, and then just apply gentle pressure. For DSEK, you want to strip the same size Decimase membrane as the graft. In DMEK, you always want to go larger. Again, for Decimase stripping, you can use the reverse Sinski and just gather up all of Decimase membrane. You can use the MST, or you can use a reverse Utrata, and they all work quite well. Just as with other things, choose an instrument or try a couple, become proficient with whatever instrument or instruments you choose, and whatever you have maybe at your center. Be sure, of course, that there's good anterior chamber fill. And again, you can either use the AC maintainer, you can use viscoelastic, you can use air. I usually use an AC maintainer unless I'm doing a combined with a cataract, in which case I have viscoelastic already in the anterior chamber. If you use an AC maintainer, and then it's a less cost than using a viscoelastic. And here is a video, and you can see at first I'm marking the cornea there. I'm marking with calipers, and being sure I can see the marks there. It helps with centration, and this you can do either for DSEK or same, making a side port and a main incision. I make small incisions first, just with a bimanual, and metatarsus forceps. And what I'm doing right now is I am scoring Descemet's membrane. When you get to where your anterior chamber maintainer is in the side port, you want to be a little careful there. With a DSEK graft, you can actually have the DSEK graft covering that area. If it's a DMEK graft, you want to avoid it. But with a DSEK, you could actually cover the incision site. You just want to be sure that it's complete. And I like this little forceps, or you can also do it with a reverse Sinskey, and you can go from either of your side ports or your other incision. Having the small incisions allows you, with the maximal amount of facility, to be able to complete the entire bed preparation. And then following scoring, you want to gently either gather with either the Sinskey or with the Descemetarexis forceps. I like these little forceps, and I have no financial interest, by the way, in MST. But you can score as well as grasp, and you see I'm grasping around there. I gather it, and then through another incision, I can just pull out the complete Descemet's membrane. I then like to use the trypan blue following this and look for any tags. Some people use the trypan blue beforehand and use that to help guide. I like to use it as a visual agent afterwards. And you could see I had a little tag there that I'm just easily grasping, and it's complete. And so that is the whole technique for bed preparation. It's really, really important to have good bed preparation. It will help you set up for the rest of your procedure. We already saw the technique there. This is just OCT after, and you can see this is what a DMEK and DSEK OCT look like. DMEK, for those of you not doing DMEK, it's a little teaser here for you for what's to come in EK.